Good morning, and welcome to our continuing series, Interviews with Disciples and Devotees. Today, again, we are honored to have Dr. Pachegaonkar. Namaste. What is our subject today?
We'll discuss about cold and sore throat.
So many people have colds now.
Yes.
Maybe that's a very good subject.
See, basically, common cold is reaction of our system against any odd temperature or even some allergens, pollutants or allergens. It can be pollen grains, it can be just dust, or it can be even sudden transition of weather. So it's the reaction of our body to overcome the trauma because of either allergens or pollutants or because of weather transition. Our ear, nose and throat, this area is very sensitive to all these temperature variations. Basically, the structure is like this, that through nose we inhale and exhale. So while inhaling, if there is any infection or allergen or antigen, which or even a dust particle, if it is trying to enter or it happens to enter our system, it gets arrested partly in the nose and partly in the throat. Especially the infections are arrested in the throat. We have a lymphoid tissue called tonsils in our both sides of throat, and on the back side, the retropharynx, what we call, there is adenoid. So these are actually lymphoid tissues where the possible infections are arrested there. So it is like a guard.
What about when they remove the tonsils?
So that is what sometimes what happens, because of some infection being arrested there, this lymphoid tissue gets infected itself and there is inflammation. And this inflammation causes like fever, sore throat, cough, discomfort, painful swallowing. And if it is recurring, some orthodox physicians used to feel that it should be conserved because it is and defense getting roused. So why we should actually find out why this is getting roused again and again, and that fault has to be corrected. But locally, like what we call modern physicians earlier thought that removing tonsils will solve the issue. So definitely sore throat wise it solves the issue, but it exposes yourself to more deeper infections. So definitely the whole immunity goes down if your tonsils are removed.
And in childhood, they remove many times the tonsil.
It was almost like a fashion before some 25 years, but recently even ENT surgeons have realized that it should not be removed. Earlier they used to think that this is working like a focus of infection. But it is not actually primary focus of infection, but it is actually the guard where any infection, any antigen entering our body is arrested there and body develops reaction. We have seen even cases of tubercular infections also getting cured because of this. Because if the infection occurs, the body reacts to it and develops a wonderful inflammatory defense mechanism. And the organisms are carried to the lymph nodes, cervical lymph nodes and all, and there they are resolved. They are disintegrated or digested, whatever you call. So these infections are carried to cervical lymph nodes, and there they are resolved. So this is the function of our respiratory tract actually.
But what about when the common cold continues for weeks and weeks and weeks?
See, there what we call, in general, cold should get resolved within 1 or 2 days. Because there is no nose which doesn't get cold. It's like, as I told you, it's a defense phenomena getting roused. But if there is maintaining cause, then it lingers like for 2 weeks, 3 weeks. In a sense, like if you don't eradicate things which are causing cold, then it lingers longer. Otherwise, it should not. Within 1 or 2 days, it should resolve. And what we advise for cold, even earlier orthodox physicians also used to advise is just a dose of vitamin C. Of course, dose in it should be in a natural course, like in the form of lemon juice or orange juice, on empty stomach. So the vitamin C helps in overcoming this immediately, and we advise to sleep 1 or 2 hours earlier than usual time. In the instance of cold, one should just 10% slower work, low profile, and 1 or 2 hours earlier one should sleep.
And how much vitamin C?
Vitamin C, if you call the doses like milligram, like 500
lemon juice or so. Yeah.
Lemon juice, we consider that like one lemon twice a day would suffice when cold is there. Otherwise, every time we suggest one lemon a day in the morning on empty stomach. But if you have cold, you repeat this dose of lemon twice or thrice in a day. That is also. Actually, common cold is not something which needs any treatment. We have to just allow our body to cure it, resolve it, or even sometimes facilitate it. And many times we advise that better prevent it. Many times if there is like drastic weather transition, then you protect like you can tie some scarf like thing around your ear, because ears and this nose, that is the only area where direct cold attacks. Cold air there is a load on our system, because whenever we inhale air, by the time it reaches lungs, it should be pure and it should be of our body temperature. So when we breathe in through nose, there is arrangement that because of circulation, that it becomes warm enough to reach the lungs. So there should be no issue. Very common complication of cold is what we call sinusitis. Now so many people are coming with inflamed sinus. It's very interesting to know that our ear, nose and throat, this passage on both sides together is maintained wet with secretion of mucus. And in normal course, each person secretes around 2 liters of mucus in this passage to maintain it wet and efficient. And this is constantly under circulation and recycling. So in a day, body secretes 2 liters of mucus.
Oh my gosh.
So what we feel in the form of common cold is nothing. It is just hardly 2-3%. But the main issue is when this passage gets congested, the sinuses which are connected, like maxillary sinus, the frontal sinus and mastoid sinus, these sinuses connected with the respiratory tract, they get congested. Their congestion occurs, stagnation occurs, and anywhere in the body, stagnation of mucus means it's a seat of infection. Automatically the organisms, undue organisms will start growing there, and that causes sinusitis. So effective circulation of mucus will never allow sinusitis to take place. There would be no inflammation or infection in sinus. Once the circulation is proper, mucus secretion has to be recycled again and again, so there is no chance of infection. So common cold is not something which one should treat it. We call it indisposition. So we have to just allow the body to cure it or facilitate to cure it. Now there are some complications like voice gets affected. Then if adenoids are like enlarged, hypertrophied, then the nose block occurs. So we have seen some instances where children especially, they develop adenoids and their nostrils are blocked, and then the congestion occurs in the ears, and there are like what we call otitis media. There is inflammation in the middle ear, and there occurs some discharge, even perforation of the membrane, and some complications. So if cold is handled well, there should be no complication. Body cures it wonderfully well. But if it is not handled well, means you try like give antihistaminics or anti-allergics or decongestants in the nose, then the body becomes dependent, and then it becomes a chronic thing. And then it's very difficult to cure. And therefore we always say that common cold, doctors can't cure it. The person individual who has developed cold needs to have active participation in curing it.
Now, all day I can hear people coughing and myself bringing up a lot of phlegm from here. Why is that, and how do we overcome it?
See, our bronchial tree is definitely having mucus. As I told you, the respiratory passage, it is full of mucus. That mucus is recycled. So it cannot be without mucus, because it has to be maintained wet and efficient. Our bronchial tree has to be maintained like that. So as a complication of cold, if it is not resolved properly, then the bronchitis or such things occur. And when there is congestion, then there are secondary infections. Sometimes if such repeated inflammations are there in some people, the bronchial wall also gets sort of a deposition, becomes rigid, and it loses its elasticity. So it cannot efficiently circulate the mucus on it, and therefore many times what we call COPD, chronic obstructive pulmonary disorders.
Right.
So these things are developed, but generally this bronchitis, or even in many cases even the minor pneumonitis cases also, they are resolved. The best thing in lungs is that if at all there is any inflammation or injury or this thing in lungs, the healing is by resolution. Healing by resolution means there is no scarring. So far as possible, there is no scarring in lung tissue when it is healed. It is healed by resolution, because everything is resolved and thrown off in the form of cough, that mucus. So what we expectorate is the mucus, which is essentially secreted to maintain it wet, at the same time the debris of inflammation. So these things are thrown out. So therefore many times if someone has blocked nose or so much of sore throat, and if the person develops like a bout of sneezing and running nose for a while, we feel it's a good sign. See, even regarding lemon juice also, there is a lot of misunderstanding that when you have cold, you should not drink it, people feel. Because lemon causes cold. This is the misunderstanding people carry. In fact, if you are exposed to certain odd weather or allergen, you develop common cold as a defense phenomena. And effectively undertake this defense or inflammation also needs lot of vitality. So lemon juice, if it is given to the person, he throws it off. The rhinitis occurs, the running nose occurs. So the cold starts getting resolved by giving lemon juice. Otherwise it gets suppressed. There would be some sort of inflammation in the deeper part of the respiratory tract. So lemon helps in resolving the cold by throwing off the mucus.
Now we have different types of lemons and limes in India from those that we have in States.
Yes, yes.
All of them are equally good?
See, vitamin C, they are citrus fruits.
Right.
And their taste, flavor may vary. But basic qualities are same. Few might be giving more concentrated like vitamin C, few may have less, and their flavor changes, but more or less their composition is same. The best source of vitamin C in India is that amla.
Amla. How is it taken?
Amla, that is the only logistic problem with amla, because to make extract juice of amla is difficult. So you have to cut the fruit, and that pulp you have to eat. And then it has to be like chewed or ground by teeth, which it comes in contact with the teeth, and therefore sometimes it is sour and it brings out the sensitivity.
Now, in the Matrimondia Gardens nursery, I grew acerola. And acerola fruit, one fruit has 1,000 milligrams of vitamin C.
Oh yes, that also. Even guava has.
And easy to eat.
Yes. That. So even guava, it is our best source of vitamin C.
Guava.
Yes,
Oh.
wonderful source.
Fresh or fully ripe, half ripe?
Actually, it should be, I would say, half ripe, or what we say best would be like ripened in situ on the plant.
Ah,
That is the best.
nothing better.
Like where we pluck and keep, and it gets ripened through the organisms. That more than that, in situ ripening is the best on the plant.
Yeah.
So if you pluck a ripe guava and taste, it's very nice to taste, but it's very effective also.
Okay. When the congestion is here and one has to keep bringing it up because one keeps coughing, how long should this last?
See, regarding cough, I have seen most of the cases of cough are secondary to hyperacidity than the common cold.
Ah,
Common cold should be resolved just in upper respiratory tract, that is throat and above. It should not be allowed to descend down. Bronchitis, or if it descends down, means it is really a complicated cold. So till the things are resolved, you should expectorate, means that mucus
Okay,
will be
okay.
expectorated, but it should be easy going. It shouldn't be distressing. I have seen cases of cough more attributed to hyperacidity, which are distressing. Really, these cases have a distressing cough. I have seen some cases that like whole night they just can't sleep because of cough, and that cough is more or less surfacing when the person lies down. So it is what we call acid reflux, which causes cough.
okay.
So in that case, no mucus comes. There is irritation, no mucus, and person is
Yes,
desperate.
I've heard the term dry cough.
Yes. So the person is just desperate to overcome the irritation, and there is no mucus. So what is he going to expectorate?
Ah,
So such cough is very distressing. Of course, there are certain varieties where what we call pertussis. Pertussis is like whooping cough.
oh,
Whooping cough is something where the child goes on coughing like paroxysm, to. Sometimes it ends in vomiting, but then nothing comes out. This is a variety. Of course, on that basis we have to treat. These are not simple common cold,
No.
but they are what we call complications of common cold.
oh.
And here nowadays people, everyone tells that, how did you develop it? If you ask that, how did you develop this cold? They will say, no, my in neighborhood some child has, so I caught it. What we consider is, even if someone has cold, and if you are exposed to that virus through that person, you should feel, blessed, lucky. So you get some common cold, which is trivial, and you get an opportunity to develop immunity. Your immune response is developed. So one need not be fussy about not going in, people who have common cold and all. This is something you should develop, and you should develop immunity against it. You can't be so much in sterilized environment. Otherwise you are vulnerable.
But we also hear that these colds mutate, and you have different types in different seasons and
Yes,
different years.
yes. See, first of all, every time the cold is not necessarily induced by virus or anything. It can be just dust, pollen grains and dust. You may any antigen. So virus also can be like an antigen where one reacts. And definitely there would be constant mutation. But what happens? Body has a vague system which analyzes whatever virus enters. Our system reacts to it, recognizes it, and develops an antidote or antibody against it. So, as there is chance of mutation, our body also has a mechanism to recognize it. Only thing is, we have to create a conducive environment. Like that time, you should have moderate food, sleep earlier, be on low profile, and body develops immunity. Even if it's a new virus, new strain,
I see.
doesn't matter. There will be little bit of indisposition, some sort of a defense phenomena getting roused, and when defense phenomena is getting roused, some sort of what we call body will get distracted from other normal functions and definitely pay more attention to this phenomena. So maybe there would be body ache, malaise, some toxic symptoms will be there. But one need not worry about it.
So now we have come to this unique word, flu.
Yes, flu again is a virus, influenza virus.
Right.
And it is definitely getting mutated, and every time little bit of modified version comes. And again, body also takes cognizance of it, comes down with something what I told toxicity of that, and then develops an antibodies, and then it is nullified. This is how it is.
Again, no treatment necessary.
That is what treatment actually. It is not medicinal intervention, but treatment means we have to just facilitate body to manage it properly.
Rest,
That is
food,
what we call treatment.
Rest and food.
Yes, like
Yeah.
vitamin C,
And vitamin C.
hibernation, early sleeping, hydration, proper hydration, and low stress. So we ask them to be on low profile for a while if they catch infection.
Wonderful.
But each instance of influenza infection will give the scope for the system to exercise the immune response. So definitely it is beneficial.
So even if there's mutation, the body
Body has that
has
potential.
that, yes.
The body has, like what we say, no, every time, even human, suppose I have a system which has countered the infections in my lifetime, my system definitely acquires that skill, and that is inherited to the next generation. So this will happen.
Oh,
So nothing wrong in that.
wonderful. Excellent. Thank you so much. Namaste.